More than just a normal reaction to stress, anxiety disorders interfere with a person's life and can be incapacitating. The good news, these problems are very treatable. Find out more next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. And tonight we're taking your questions on anxiety. So call the numbers on your screen right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And of course, you can also text us your questions or email them using the number or address listed at the bottom of your screen. We're going to start, as always, by introducing our guest. Dr. Dan D'Allard is a licensed clinical psychologist with the Duluth Psychological Clinic who conducts psychological evaluations and provides therapy to a broad range of clients, including those who suffer with anxiety disorders. And Dr. John Glick is a board-certified psychiatrist with the Human Development Center whose interests include complementary medicine as well as traditional Western approaches to the treatment of mental illness. Thanks to both of you for coming out here tonight. And I think since I sort of introduced the show that anxiety disorders is different than just the normal day-to-day anxiety. Dr. Glick, we'll start with you and tell us a little bit about, in general, how our anxiety disorders differ from normal anxiety.
Well, to call it a disorder assumes that either it's severe enough that it's affecting somebody's ability to function day to day, or that it's causing a real marked level of distress and subjectively.
So if I'm afraid of heights and I'm not a trapeze artist or a high steel construction worker and I'm just sort of in my on-the-ground job, it's not necessarily an anxiety disorder.
That's exactly right. We use the phrase a clinically significant degree of impairment or distress. If you don't encounter high wire or trapeze acts very often and aren't called on to do it, it's not very impairing. I often talk with clients about the Komodo dragon test. We all have a fear or phobia of Komodo dragons, but we don't encounter them, so it doesn't qualify as a disorder.
I didn't know I had that fear of Komodo dragons, but now that you mention it,
you're diagnosable.
I can see your point. So anxieties are different from the normal day-to-day anxiety and stress that we feel in life, which everybody has then. Let's talk a little bit about, we're gonna talk about 3 different anxiety disorders and kind of explain the disorders to you, and then, towards the end we'll talk about treatment because they are very treatable. I think let's start with generalized anxiety disorder.
Sure. Generalized anxiety disorder is about excessive worrying. Worrying is a typical part of daily functioning. It's adaptive to some degree to worry about what's coming up. But when that worrying takes up a great deal of time, and when we have difficulty controlling it to an age-appropriate degree, and controlling worrying means things like I can distract myself at times, or I can choose to stop thinking about this and think about something else. And when that worrying is associated with things like sleep impairment or irritability, etc., then it begins to shade into the disorder side of the spectrum.
And it's also, Dr. Glick, isn't it, about worry in the face of evidence that there's not a need to worry to that degree?
Yeah, it's irrational in the sense it's a little bit like worst possibility thinking and just never being able to shut off that worst possibility thinking. And those worries are always on one's mind, and one can't shut them off. And as Dan said, they start to interfere with sleep and cause headaches. And it's just like the worry takes on a life of its own. And you really just can't shut it off.
And it's across also several different things in your life. It's not simply worrying about money, when maybe you have financial problems, or even if you have financial problems, it's not just worrying about money, it's worrying about many things in your life.
That's exactly right. That's the generalized part of the generalized anxiety disorder. There are times when we ought to spend a great deal of time worrying about a particular thing in our life. Mm-hmm. Our home is about to be foreclosed. We ought to be worrying a good bit about how we're going to handle that. But the generalized piece says that we worry about a broad number of things to an excessive degree and don't control it very well.
And can worry lead to panic then, Dr. Glick?
Yeah, it can lead to all sorts of negative effects. Sleep disturbance, headaches, muscle tension is really common with generalized anxiety disorder. Palpitations of the heart. The body starts to feel the effect of the anxiety, definitely.
And in fact, that's part of it, is having a lot of physical symptoms along with the anxiety. How about children? Do children experience generalized anxiety disorder?
Absolutely. In fact, it's true for most anxiety disorders that children experience them oftentimes similarly to how adults do, but at an age-appropriate level. And things that might not worry us as adults very much might be very anxiety-provoking for kids. I work with kids a fair number of times who have a separation anxiety. It's tough to be away from mom or dad. And that often looks a good deal like generalized anxiety. If that gets generalized to, if I'm not around a teacher or a coach or some adult who's reassuring, then again, that separation anxiety broadens into something more generalized.
And how is, say, the treatment for generalized anxiety disorder different or the same for kids as it might be in adults?
Well, I think it's pretty similar. It's in both populations. It's a matter of learning some skills to be able to control that anxiety, that worry, to be able to shut it off, to not let it control your life. And then medications can be used in both populations also.
And what have you found in your treatment of kids versus adults?
Absolutely. Of course, you have to tailor the treatment to the developmental level of the client. So with children, we'll often work on, say, distraction, where an adult can make a more realistic appraisal of the thing that's worrying them and say, you know what, as I examine that further, I don't really have to be that worried about it. Children often are more captured by it, and as long as they're thinking about it to the nth degree, and it's worrying them. So we'll work more with distractions, say, with kids. What else can you think about that's interesting and engaging or do that absorbs your attention so that you're not overwhelmed by the thing that you're worried about? So distraction is more common in my work with kids than, say, with adults.
Excellent. Here's a caller from Cloquet, 40-year-old, asks, anxiety attacks, normal age of onset. Dr. Glick.
There's some anxiety attacks, for example, in the context of panic disorder, often would come on in the late teens, the early 20s, and a panic attack is a real intense surge of anxiety that comes on real quickly, feels really overwhelming. People are worried they're going to die or go crazy or lose control. Heart is pounding, short of breath, choking, dizzy, GI symptoms. It's usually brief, comes out of the blue. That's a typical panic attack, and often in your teens, early 20s. People with generalized anxiety disorder that we were talking about can develop panic attacks, but it's usually in the context of the worry just becoming overwhelming, whereas with panic disorder, it's more out of the blue.
And in fact, people often aren't able to pinpoint all of a sudden why they're feeling this way. One of the things I've noticed most about anxiety attacks or panic attacks, as they're commonly referred to, is when I ask somebody, have you ever had an anxiety or panic attacks? If they say, well, what do you mean by that? The answer is no. Because people, it seems that people who have had anxiety and panic, they absolutely know the difference between that normal anxiety and that overwhelming sense that people get when they have a full-blown panic attack then. So that's generalized anxiety disorder. Let's talk about obsessive compulsive disorder. And we hear often, and people say in everyday life, oh, she's OCD, or I'm a little OCD. So let's talk first, Dan, by describing what is obsessive compulsive disorder.
two parts to it, as the name implies: obsessive thoughts, so a preoccupying, repetitive thought about something that's not in and of itself usually concerning to people. And then the compulsive part is a behavior, typically a repetitive behavior that has no real functional value, that one feels compelled to do to reduce or eliminate the obsessive thoughts. So I have an obsessive thought about being dirty or being contaminated, can't distract myself from it, can't talk myself out of it, and feel as though I have to do some compulsive behavior, such as washing my hands or checking my shoes, in order to get rid of the obsessive thought. So it's a cycle. And of course, if it works, so to speak, to do the compulsive behavior, if it does relieve your anxiety about the obsessive thought, you tend to feel as though you need to do the compulsive behavior, and a cycle develops.
And here again, we're often talking, so if we're talking like checking to make sure that the iron is plugged, most of us might check once or twice, but then we are reassured once we have checked that, and we don't have to check that third time. People with obsessive compulsive disorder may need to check 30 times and still not feel reassured by that.
That's exactly right. That failure to be reassured by the first check is a hallmark of the disorder.
And so that compulsion then is somewhat relieving but never completely reassuring. Would that be a way to describe that, Dr. Glick?
Yeah, I mean, oftentimes a compulsion is about, trying to reassure or prove that something's okay, but the more you try to prove something's okay, the more you realize that it's, it kind of reinforces the fact that maybe things aren't okay.
Now, I have read or heard that some people feel that obsessive compulsive disorder kind of is a class in its own and may not even belong with the anxiety disorders because there's a belief that the brain functions a little differently. Comment on that for us.
Well, there's clearly a genetic vulnerability to obsessive compulsive disorder, and certain biochemical differences that have been identified involving the serotonin system and also how information is processed in the brain. So yeah, there's clearly some pretty distinct differences that set it aside as a unique disorder.
And treatment for obsessive compulsive disorder?
The best treatment is probably psychotherapy. And usually that involves kind of exposing oneself to the feared condition, and then instead of running from it or using a ritual or a compulsion, just trying to be there until the anxiety subsides. That's called exposure, and then preventing your normal response of doing a ritual. So that's very effective, and everybody with OCD should definitely have psychotherapy, and for a lot of people that's all they need. If they need more, medications are also helpful, especially added to psychotherapy. And the medications that we usually use first are the serotonin-boosting antidepressants, Prozac, Paxil, Zoloft, Celexa, Lexapro. Quite helpful for all anxiety disorders, actually, but also for OCD.
And the treatment of OCD in children, because OCD can occur in children, is that correct?
Of course.
And the treatment for OCD in children, talk a little bit about that and how that's different from working with an adult and
That's right.
Your use of the parents or the family.
The principles that Dr. Glick described are essentially the same. We want to identify the obsessive thoughts or the situations that provoke obsessive thoughts. We want to rank them from kind of most impairing to least impairing, and then we want to help the child be in the presence of that thought or situation that usually provokes a compulsive behavior, and then help the child not do the compulsive behavior. Now, we often need parents to assist with kids for some obvious reasons. One, kids don't have the same degree of insight into what provokes compulsive behavior, so often parents have to help us develop that hierarchy of what is it that seems to be the trigger here. We also sometimes need to coach parents to not offer excessive reassurance or help the child perform the ritual. I mean, out of the goodness of their hearts, parents often want to reduce distress for their children, so they may help with the ritual or compulsive behavior. We want to get the parent out of that role. We want to get the parent offering a a lot of reassurance for, hey, you can have this thought or concern and not do the compulsive behavior. So the parents are coaches or partners with the children often. And that can be true for adults too.
I was just going to say
Yes.
that one of the things that happens with anxiety disorders is that friends and family members can be co-opted by the person who has the problem. As you said, out of a sense of compassion, I want to help you to feel better, but then become entrenched and part of the problem and need some helpful instructions on how to extract themselves, especially since that means we're going to be making the person who we care about, who they care about, initially a little bit more uncomfortable, because that is part of the treatment, that initially you are a little bit more uncomfortable, correct?
Indeed. You know, the compulsive behaviors reduce discomfort, and you have to take them away and increase discomfort originally.
A little bit more uncomfortable, but the key is that you need to teach somebody skills so they can deal with that discomfort, and that's a part of the therapy process. So yes, whatever anxiety disorder, you're going to be exposed to the fearful situation, but you're also going to have the skills to be able to cope with that fear, because that's part of the therapy process.
And in fact, a lot of therapy now teaches those skills first, those anxiety-reducing skills like deep breathing or calming and centering skills, mindfulness skills, and then do the exposure work to the feared stimulus, or to the thing that they're most afraid of. We don't have to call it a stimulus here. We could call it the thing you're most afraid of. We have this is sort of, we're going to backtrack just a little bit here. A caller from Superior says, if someone has excessive worries to the point where you're up all night pacing, can it cause physiological problems or immune problems, Dr. Glick?
Oh yeah, sleep deprivation and stress clearly can weaken our immune system, no doubt about that. And maybe one of the mechanisms for that is by raising our stress hormones, like cortisol, for example.
So I think this is really important, because one of the things we've been talking about through this season and on this show, through last season and this season, is that notion that it's not mind and body out here, but it is that interaction and that melding of the two, right? That there is that interactive effect, that what's going on in your head is affecting your body, and that your head and your mind is a part of your body then. Social phobia, and I'm so glad that we're going to talk about social phobia, because a lot of people want to hear about social phobia. I have a lot of you are calling in about this. Please talk about social anxiety, and would the feelings of shyness be a type of anxiety?
Terrific question. It raises the point that the line between normal range behavior and disordered behavior, so to speak, is often a fuzzy line. There's a great deal of clinical judgment involved when we make the decision whether someone is, within the typical range or not. Social anxiety is more disabling than shyness. Many of us are shy to some degree in certain situations around certain people. Social anxiety disorder involves so much anxiety in interpersonal situations because we are focused on concerns about being evaluated or judged by other people. To be concerned about other people's opinions of us is typical. But when that becomes so great that we avoid social situations, or are tongue-tied, or sweating profusely, or what have you in those situations, then we may be moving towards the disordered end of the spectrum.
And there are some people who have this to a degree. In the days where we used to write checks, and now we only sign on little e-signature cards, but where even that is difficult for them because the cashier's standing there, and they feel scrutiny even in that situation. Dr. Glick?
Oh yeah, that you're right. We're writing less checks, so I don't know, maybe it's transferring over to the ATM machine now. I don't know, but there's many different forms. Shy bladder in a public restroom, performance anxiety for a pianist where they're worried about their hands shaking, public speaking fears, just many different types. Fear of meeting new people.
And I, it's so funny because you mentioned public speaking fear. You wouldn't believe how hard it is to get guests to come on here, because They often, and I can tell when somebody has this fear of public speaking, because when I say, so what do you think about coming on the show? They turn white and start sweating, and it's like, never mind. I already know I already know your answer.
Sure.
And sometimes when people have that, what I guess I would call that phobic response, they don't even, when you talk about the thing that they're afraid of, just talking about it makes them anxious as well. Right.
That's right. They don't have to be in the situation to feel the anxiety. Talking about it evokes the physiological and emotional responses that they have in the situation. And right, it's even tough to talk about it.
Now, social phobia, is the treatment different for social phobia?
It's pretty similar to the treatment we've talked about for the other disorders. The general principle is make a hierarchy of anxiety-provoking situations. Then tackle the first one, the one that's, or I should say the one that maybe evokes the least amount of anxiety. And
the thing that would be maybe easiest for you to try.
That's right. And titrate your exposure to it, and don't do the thing you usually do, which is typically avoidance. I won't do it. Well, stay in the situation that makes you nervous. And then once you feel comfortable with that, you move up to maybe the next thing on the list.
And the old school way of any exposure treatment, this exposure to face the thing you're afraid of, which is so counterintuitive to because when we're anxious, we don't think, I should stay and feel anxious. That's the thing that will help me the most, which is how people get into this avoidance pattern. And yet, facing the thing that fears you that you fear most is what really helps the most.
Mm-hmm. Yeah, facing it, but also having skills and knowledge to deal with the anxiety that comes up in those situations. And education is such an important, helpful piece of treating anxiety disorders. People just need to know what's going on. And a big part of anxiety disorders is our body's fight or flight system that pumps out adrenaline just gets disconnected from reality to some degree. So if we're in a situation we don't need to be afraid, but our fight or flight system thinks we do, and learning how to cope with that, but first being educated about what's happening so that you don't make it worse by not knowing what's going on is an important part of the therapy too.
Here's a question. How do you get someone help for anxiety who's maybe afraid to go out of the house, they're afraid to leave their house, to get the help?
Boy, that's a tough one. Occasionally we'll get a phone call from a concerned relative. I know Sally needs to be in your office, but part of the problem is Sally won't leave the house. It's certainly possible to start with telephone conversations with people. It's certainly possible to have the person who's most trusted by that person come with them to the office. Sometimes it's helpful to help the person identify the thing that they most would like to do that the social anxiety gets in the way of, and say, come to the office once, let's develop a plan so that you can do that thing. I want to go to my son's graduation. Okay, what a goal, what a motivator to help someone, take the risk to come to the office for that initial session.
Here's a caller from, I don't know where they're from. I thought it said where they were from, but it didn't say where they were from. How do I know if I should go off my medication? I feel like it's helping. How would my doctor and I know, and what's the process to decide to stop taking it for my anxiety disorder?
Well, in the setting of an anxiety disorder, first of all, you're more likely to be able to go off your medication successfully if you've had some psychotherapy, and if you've also had a period of 6, 8, 12 months where you haven't had much in the way of symptoms, if it's a time in your life when you're not under a lot of stress. So, but every situation is individual. I think the important thing is working with whoever's prescribing for you and probably going slowly. And sometimes if you haven't had therapy, maybe starting to work with a therapist as you're going off the medication can help to facilitate getting off the medication if that's your goal.
And really what you were saying too is the key is that open communication with your physician or the person who's prescribing for you, rather than playing doctor yourself and deciding, I'll just stop this right now because I'm feeling good. That's not what we recommend that people do, in fact. Can extreme anxiety lead to schizophrenia?
By itself, no. Certainly someone who is in the beginning stages of developing schizophrenia will likely have a great deal of anxiety. but anxiety itself does not lead to the sort of severe and pervasive reality distortion that we see in schizophrenia.
Although I think in how I even, like, after I read the question, how I heard the question also was what I hear in my office a lot, which is people coming in and having panic attack, if they've been having a lot of panic attacks and they're generally fearful, that sense of I feel like I'm going out of my mind, which also is just a hallmark of a panic disorder as well. So we understand why you called in and asked that question then. Dr. Glick, is there a preferred natural supplement or vitamin to help decrease or treat generalized anxiety disorder?
Well, if you want to treat anxiety naturally, I think you're going to do a lot better with psychotherapy, yoga, tai chi, exercise, learning coping skills, self-help books on anxiety, those things. I'm not really aware of anything that I think would be real reliable in terms of, natural chemical treatments.
So here, the complementary medicine is the yoga and the tai chi, the qigong, those types of activities, I guess we'll call them. And we are up. Our time is up. Once again, it's another short night here at Speak Your Mind. And thanks to all of you for calling in. You guys did a great job tonight. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links and read my blog. Now, I have the blog done. I just didn't get the finishing touches in to Whitney to get them on, but she's going to do that tomorrow. So stay tuned, because we have bloggage coming your way. Please tune in for next week's show when we talk about autism. With the prevalence of autism having increased over 600% in the last 2 decades, can you believe that? That's a lot. There's a good chance you know someone who has a child with this complex and often mystifying disorder. So we're going to find out all about autism next time on Speak Your Mind. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.